Hello everyone, and thank you for joining us today for the second MedTalk seminar in our second year of YMS. As you all know, YMS is committed to providing high school students with an interest in medicine access to expert medical professionals. My name is Akash, and I'm the founder and president. And I wanted to welcome all of our existing members and new members as well. And thank you all for your support as we learn more about careers in the health field. Today, I'm particularly excited to introduce Dr. Vivek. So Dr. Vivek came to the United States in 2003 to pursue postgraduate training in the best medical system in the world. He worked as a hospital-based physician for 11 years in New York, during which he managed a multitude of medical illnesses and patients with significant comorbidities. This ultimately led him to switch to becoming a primary care physician. Dr. Vivek now works at Kaiser Permanente, where he is able to practice medicine in his areas of interest, which are diabetes, cardiovascular disease, and disease prevention. So with that being said, we will have him provide some introductory remarks and have a Q&A session after that. So thank you for making time to join us today. And if you could please start by telling us a little bit about your childhood, where you grew up, and what experiences made you want to initially pursue a career in medicine.
Good evening, everyone. So I'm Vivek. So I came, I think Akash pretty much laid out my whole life history in front of you guys. So I grew up in India till about, and I was there until medical school, and then I moved to the United States. So I grew up in the southernmost tip of India, almost, I would say, a stone's throw away from Sri Lanka, actually. So in a little village called Panagudi, and both my parents were doctors. I mean, my grandfather was a doctor, so I was like, my uncle was a doctor. I was surrounded by doctors. So there was always this influence on me that it was always a medical talk. It was pretty normal in our dining table to talk about someone having diarrhea. And I'm sure it would put off a lot of people, but that was part of my parents' regular talk. I just grew up to that. So these were the early childhood, inputs. And then I could see my dad ran a little clinic. Both my parents ran a little clinic. My dad was a pediatrician. My mom was she was a general practitioner, but she did a lot of obstetrics. She delivered like 4 or 5 generations of babies until she retired. So, and people looked up to them like literally like gods. They worshiped them, and it was pretty amazing. I mean, my parents would be treating like 3 generations of the same family, and they would be so grateful. So these were the early positive experiences, impressions I had, which sort of made me think, oh, okay, maybe I should do medicine too. So I did. So all my schooling was in Tamil Nadu state, and then I got into a medical school in Bangalore, where I was there till 2002. So, and then I came over here to do my master's in microbiology and immunology. That was in New York. Ever since I came here in August of 2003. So almost my entire 18 years, almost the 17 years has been in the East Coast. And only the last year I've been in California. And that's pretty much it.
Okay, thank you for a little bit of that background. So what we're going to do now is have our officers pose questions to you before opening up the Q&A to other participants. So if we could start with Rahul for the first question.
Hi there, Dr. Vivek. My name is Rahul. I'm the VP. My question to you was, you initially graduated from MS from Maya Medical College in Bangalore, India. Can you tell us how you decided what degrees to pursue to support your career?
Well, medical school in India is a little different from the United States. So you don't go through pre-med. You go straight from high school into med school if you decide to do medicine. In my in my dad's generation, my mom actually, back then there was sort of, you had to have a college degree before you, so a lot of people would go do an undergrad degree and then go into med school. So that's what my mom did. But somehow that changed, I guess. I don't know what happened, but anyway. So, and the other difference is that in India, you could do, it's 5.5 years. After those 5.5 years of med school, you don't really have to do your residency. You don't have to do internal medicine or surgery. You can just practice as a GP or a general practitioner. So, as when I was looking around, it's pretty tough to get into med school in India. So, when we were, by chance, I just landed up in Bangalore. I mean, I just sort of applied everywhere, all the good places. I figured, wherever it is, I would go. So, and I got it in Bangalore. And, it's just happened that a big part of my dad's family also lived in Bangalore. So it was easier transition for me going from my home to my family's home. Unlike here in India, each state, going from one state to the other, it's sort of like going from one country to the other. So, it's a different language, different people, different culture. So it's a big adjustment. And then when I decided to pursue my master's, that was a totally different reason altogether, which I can get to also.
Okay, then thank you.
Hi, Dr. Vivek. I'm Archie, and I'm the treasurer. And can you share how you chose to go into the field of internal medicine? And please share some of your experiences going through training and experiences that stood out as key learning moments.
Oh yes, I mean, I remember that very vividly because it's one of your. So when I was in medical school, when I decided to go into medicine, I did not want to do internal medicine. I wanted to be an orthopedic surgeon because I just felt it was cool, and I just felt being an orthopedic surgeon, it was the ultimate thing to do. So just to backtrack, like how I said, medicine in India is different. You do like 5.5 years, in which the last year, once you're done with all your med school rotations, you do a year of internship where you rotate through 2 months in medicine, 2 months in surgery, 2 months in gynecology, pediatrics, different, and then a month each in other departments, electives. So when I was doing that, that's when I realized I did not like surgery at all. I mean, I thought, oh, maybe I started out with general surgery, and I said, oh, I hated it. I said, well, maybe it's because this is not orthopedics. Maybe if I go to orthopedics, I'll like it. So by the time I ended up in orthopedics, I just did not like surgery. And when I did my medicine rotation, I just felt that, oh my God, this is what I want to do. I mean, I would go with my senior residency. You would be on call as a medical student. You're not, as a medical student, you're not actively treating the patient. You're watching, learning, but you're following your senior resident who's going to do that. And you see them go to the ER. Someone's trying difficult to breathe, and they put intubate them, which is putting a breathing tube in. And, it just appealed to me and just felt, and that's when I decided internal medicine is the way to go.
All right, thank you.
Hi, Dr. Vivek. My name is Akarsh. I'm the videographer director. And my question is, what convinced you to move from Bangalore to America in the scope of advancing your medical career?
So, to be honest, I wasn't focused on America. So I was thinking, I looked at both the United Kingdom or the USA, only because I wanted to do something different. I always wanted to do post-graduation. So, like I said, in India, that's an option. But, I felt I didn't want to be a GP. I wanted to specialize. do something more than just being a, a duck in the box, you would say. So when I was thinking about it, so a big influence was that in Bangalore, in my college, there were always, every class had a big group of, should I say Indian Americans or Indian Americans, right? So guys like you who grew up in the US would come back to India and do medical school. So that was my first exposure. So they would talk about, they knew the system here. So they would talk about the US medical system. So that was the first exposure. So when we decided, when I say we had a close group of friends and we all decided, okay, this is what we are going to do. So a lot of people who decided to come to the US or UK decide much earlier these days. I mean, like in their second year of med school or something. But we, like, for no good reason, didn't make a decision till I was almost done with my medical school. But ultimately, that's what swayed it. I mean, because I had a lot more friends. As I started to learn more about the US medical system, how it's done, it just appeared pretty cool to me. I mean, it's like, wow, this is how you do medicine? Okay.
Awesome, thank you.
Hi, Doctor. My name is Tumin, and I just have a quick question for you. Can you tell us about the impact of COVID-19 on your work and how it has impacted how you work with patients? And also, if you could share some of the setbacks due to COVID.
Well, so I saw COVID firsthand because like Akash said, in the beginning, I worked as a hospital-based physician for 11 years before I moved to California. So I worked in a suburb of New York City, where actually the first case of COVID recorded. And we were one of the first hospitals in the state to start getting COVID patients. And, we were hit pretty hard. I mean, so last March of 2020, that's when it started. And, we didn't know what hit us, and it was just wave after wave. It was pretty tough. I mean, if you think about it now, people talk about, oh, there's a vaccine, there is these antibody treatments, there is this, there is that, and all these controversies about, oh, we could use ivermectin. But back then there was nothing. We didn't know what it was. It was very strange, and people were dying. There was a lot of people dying right in front of our eyes. So it was pretty traumatic. Every recovery we applauded because recoveries were very far and few. So it made us, it really made us value life even more. I mean, going home, normally you would finish your work, go home going home is taken for granted. You sit with your family in the couch, watch TV, but this changed everything, my basic lifestyle, because now here I was going to the garage, after a 12-hour shift, trying to change in the garage, or like just run up to my bedroom, change, and I would sleep by myself. It made me value life more, and it was just a sad phase.
Perfect, thank you.
Okay, so I had a question as well. So if you could tell me how you manage your stress and like any anecdotes from experiences you've had in the past.
Well, that's a tough question. I mean, so I try to compartmentalize. I don't carry my work home on most cases, because I feel like if you carry it home, that's one of the reasons which you carry your stress. I mean, so whatever, I try to box it up, leave it here. So once I'm done, I'm done. I don't carry it home. Despite that, there are few incidents where it will seep through and you feel emotional about it. I deal with it by just rationalizing, just thinking to myself, okay, maybe this is how it was meant to be. Sometimes if it's acutely stressful, it's crazy, but I just sit and play a game on my phone. It actually de-stresses me. So that's for the acute stresses, but something very serious, it's me talking to myself, all right, we just have to get through the day, it's just bad day. But I don't get stressed. I mean, I'm not saying just because, I have to, but it's just stress is not a big issue so far, at least in my work and in my life. So I seem to be handling it well, okay, so far.
Thank you. I think that pretty much summed it up. Also, like, kind of as a follow-up question, how often, like, on average, how many hours a week would you say you work?
Right now, I just work a regular, like a 45-hour a week schedule, just like any other job. I used to work much more in the hospital, because the hospital work, it's all 12-hour shifts. So we used to work much more than this.
Oh, okay. I see. Thank you.
I also had a question, Dr. Vivek. So throughout your career, what do you think, would you say was like your big milestones that you've had? And are there anything else, like any other things you want to achieve in the duration of your career?
Well, I don't have big plans right now. I just want to be on cruise control, but I think I've achieved it in my other job. I mean, I started off as a staff hospitalist, and I became, in about 5 years, I became a co-director of my department. It's titles aside, I was just happy that people like me, and you can forget the titles, because sometimes you can get titles for political reasons, but if you get the people to you work with to like you, I mean, that's the best prize you can get. So I mean, it was very difficult for me to leave my other job and come here, because it's not the money or the job. I just miss the people I worked with. So that's something which you earn, and it takes time.
Okay, thank you.
And then I have one last question. So in your opinion, what do you think the perception about the advancement of medicine is currently, and what direction do you think we're heading in?
I think medicine is going really good over the last few years, I would say. I mean, earlier on, it was the breakthroughs, what's called an immunotherapy. So these are drugs which attack diseases by modulating your immune system. So they sort of tweak your immune system and make the immune system fight against either the cancer or whatever condition you're fighting against, as against the drug themselves causing, going in and doing the battle. The advantage of that was, by making your body's immune system fight for you, you're not facing any side effects, theoretically at least, from the drug, as much as the drug itself. Because in cancer, in the olden days, if you had cancer, they gave you chemo, which is still a fact in many cancers. The people who have cancer in certain situations start having more symptoms from the treatment than from the cancer itself, from the side effects. So I think that's a big breakthrough with this immunotherapy. The other breakthrough, I would say, is the mRNA, the vaccines which came on, which is based on the mRNA technology. So initially the mRNA technology was being studied even before this vaccine. This was an experimental study. They were thinking, oh, this is a promising way of delivering anti-cancer treatment. So when COVID hit, they made a vaccine out of this, and it turned out to be a pretty good vaccine. So I think that's the next big avenue of for medicine in the future, because I think they are trying to look at potentials for treating multiple other illnesses with the same mRNA technology.
Okay. That's it's actually pretty interesting. So with that being said, I think we have one more question from one of our officers, then we can get into the normal Q&A.
Sure.
So before we open it up to the rest of our members, are there any suggestions or pieces of advice that you can offer to those that plan to pursue a career in medicine, or any specific remarks you can offer to those interested in going into internal medicine in particular? So anything you wish someone had told you while you were studying, or just general advice?
Well, the general advice would be, just follow what your passion is. I mean, you guys obviously know that. The first thing you want to know is, don't follow don't do medicine. It's just because, you have people pressuring you, or if there is a peer pressure to do it. No, or it's a parental pressure to do it. Do it if you really like to do it. And as you start doing it, then decide what you want to do in medicine, whether you want to be a surgeon, or you want to be a radiologist who likes to look at films. I mean, look to see what's your calling, and that you will only know when you start doing your rotation. If some people know from studying, I have a cousin's thing, and when he joined medicine, he said, "Oh, I want to be a family doctor." So I guess there are some people like that, but most people, I would say, just follow what you like and just go along with it and work hard. I mean, there's no shortcuts there. And it's much more intensive in the US than in India. So.
Perfect, thank you. And with that being said, if any of our general members would like to ask a question, feel free to raise your hand, etc.
Yeah, so we actually have one question so far. So someone asked me to ask Dr. Vivek, besides the difference in admission style of med school in India and the US, from seeing other doctors who studied in the United States, what do you think is the biggest difference?
Communication. I mean, you're not taught to communicate in many countries outside, I guess, especially in the Asian culture. So that was a big difference. I mean, I did see it when I go back. I didn't realize it growing up in India, because that was never a thing which you were taught. You were just taught, you learn about your disease. You go see the patient and you tell them, okay, this is what you have. And I prescribe you this, take this, don't ask me any questions. All right. And here, when I came here, which I think I like, you're encouraged to have a conversation, because you're mandated to have a conversation now, because, you explain to them what the treatment is, what it involves, what are the side effects, what are the alternatives. So I think communication is the big difference here, and it still is. And which I think is a good thing, because, patients deserve to know more, whether it's the insurance paying them or they're paying out of their pocket. You're treating them, it's their own health, and they deserve to know what you're doing to them.
Member submitted a question to me asking, it was a good question. So what's the difference between internal medicine, family practice, and general practicing?
There is no general practice in the United States. So the concept of family medicine is unique in the US. I'm not sure if it's there in Canada, but that I can explain what the difference is between internal medicine and family medicine is. So in internal medicine is more, it's vastly geared towards complex medical illnesses. So internal medicine doctors like me we don't see our children or adolescents. We only see patients above the age of 18, because that's what we are trained to, and our medical license allows us only to see people over the age of 18. And we do a lot more rotations while we are doing our residency training in inpatient in the hospital. We do more ICU rotations. So we deal with a lot more complexity of care. We do outpatient also on a regular basis over the 3 years of training, but the family medicine doctors do a lot more of this outpatient. So their concept is treat the family as a whole. So as a family medicine doctor, they get to treat from a baby to old age, the entire spectrum. They see women's health, like simple gynecological issues, which we don't. They see obviously pediatrics, they see adults. So they see a lot. See, the good thing about that is that they can manage to treat the family as a whole. So if I took my family to one doctor, they can see me, they can see my little children and my wife. So everyone at the same time. The flip side of that is that, because they don't do as much as of inpatient medicine as internal medicine, so they sometimes find it challenging when they want to do inpatient medicine. So that's the main difference. But as an outpatient doctors, it's not a big difference. They're great.
Okay, thank you.
Okay, and then someone else sent me a question. So it was, what parts of cardiovascular disease are you interested in? And what do you do in that field of interest? So like, what kind of research have you conducted, etc.?
Well, we have not, hold on a second. Oh, I'm on a call.
Oh, sorry.
Sorry about that. So, well, I have not done any research in cardiovascular. It just was an area of interest in my practice. That's all. The location I'm at in California has a lot of in Antioch. I live in Antioch, which is on the East Bay. Not live in, work at, and it's got a huge population of people with like poor diabetes and heart problems and financial issues, and they're non-compliant. And the reason they're not compliant is because it's not that they don't want to take it. It's just because they can't afford to take the medicines despite having insurance. Sometimes they're unable to afford medications, or they're unable to take a day off to come see the doctor. So, so my goal is to sort of cardiovascular prevention in these populations by focusing on getting them to controlling the risk factors, which is getting them to, control their diabetes better. If you can't come in every 3 months, that's fine. Maybe can we do it at least like 6 months or so, or come to me, talk to me on the phone. So little steps so that in the future, if we control the risk factors, the hope is that they will not have a bad heart attack or a stroke.
Okay. Thank you. I hope that answered your question.
And then someone asked me to ask, what was one incident that changed your perception on medicine?
Oh, well, it hasn't really changed. I mean, I have had so many incidents, so I don't know if it's a good, if you're asking about a good change or a bad change. I mean, each day, if you, in these 12 years, sometimes I feel, oh, we've seen it all. And then something comes before you, which you're like, oh my God. So, there was an incident several years ago in my inpatient world where it really made an impression on me, where a older person came into the ER and was put on a respirator, though her wishes said she didn't want to. So in a panic, the family decided to put her on a respirator. But she woke up and she was able to say, take me off of it. And I was the doctor who was admitting her. And I said, listen, if I take you off of it, you will die. And she was completely at peace with it. And she said, it's fine. I know what I'm doing. So we ended up having a family discussion that same evening and explained to them, she's gone through a lot, and she might make it out of it. She's not in a terminal condition now, but it looks like this is what she wants. So ultimately, everyone was on the same board, and we had to pull the plug and take her off of it. And she passed away peacefully. But that really changed my impression on medicine, only because we had a lot of strong words between the ER doctor, ourselves, because the ER doctor strongly felt, whatever done is done. Why do you want to take it out now? She's going to make it. Let her make the decision next time if this happens. But but we had to tell ourselves, but that's not what the patient wanted. This is what we're treating. We're not treating ourselves. You have to treat the patient. So that was a very strong influence.
Perfect. Thank you.
Another one of the members asked me to ask, so you said earlier today that you never did your residency in India, and when you started in the US, did you need to do a residency here?
Yes. Excuse me. Yes. You have to do a residency in the US to practice.
Oh, okay.
So I did 3 years of internal medicine. Yeah. So I was telling you earlier, so I decided that only in my final year, or towards the end of my final year of med school, that I really decided, okay, maybe I should, that I decided I wanted to go outside the country. By the time I decided it was the US, the school was done. And, the one important thing in getting into med school, and which is important for you guys too, is that, any residency, any med schools, your CV, there should not be any holes in your CV. No, say I did high school till June of this year. And then from July to August, I did this. But if you leave that gap between July to August and just say, oh, from September, I went into grad school, that's considered a negative here. And because they will ask, what were you doing in those 3 months? So, you can't just say I was at home, because for some reason that's considered a black mark. I mean, I guess I could say you can say I'm traveling the world, but you got to say something and explain it. So in my final year of, so when this happened, so when my friends, when I learned about this whole process, I needed to have pass 3 exams to get into residency. And each exam, the USMLEs, took at least like 2-3 months of studying, like hard work. So I figured it's going to take me at least a year, even if I studied it back to back, to finish all these 3 exams. So that prompted me to make get into grad school. So I said, let me at least, I always liked immunology and microbiology. Let me do a master's course while I study for my exams, so that now in those 2 years I'm doing my master's, I'll have a degree, and there won't be a hole in my CV.
Okay, thank you.
If anyone else has any questions, just feel free to message either me or any of the other officers. So we can go ahead and wait for a few minutes to see if anyone has any other questions. Oh, okay. I got one. So what was the GPA that, or if you feel comfortable sharing, like in your academic history, like around what GPA did you have, and how relevant would you say it is, and how much of a weight does it hold?
So we don't have GPS in India, so it's very difficult to, you can convert it because it's given us marks. It's a percentage. There is no GPA system in India. And that's one of the challenges we face, we used to face as an international student applying here. So I don't know, so we just used to send out transcripts. I don't know how they figured it out. So I guess I think the schools might have a way of figuring it out, but I have no idea.
Okay, that's fine. So maybe like as a follow-up question for that, like in India, when you were first getting into med school in Bangalore, for example, like how much of a weight did your grades coming out of high school hold?
It so yes, so it depends on the state to state. So in my state, so I had really good grades in my high school. So they would take that. So in India, there is no interview process. So it's purely based on academics. So if you want to get into med school, you just write, you have to do well in your school, in your high school. Then you have an entrance exam, and you have to do really well in that to get into the med school. So in the state I did school in, where I didn't get into med school, I had really good grades, but I missed the cutoff for the med school because I couldn't get in because the pressure. I mean, I could not. I mean, there were at that time there were only like 8 or 9 med schools in my state, and each school would have 150 in a class, in an incoming class. So 150 times 8 is what, I don't know, 1200. So 1200 seats, but there would be like 50,000 applicants. And so you really have to be like the top of the top of the top to get into a med school. And then in the neighboring state, so I applied there, and there they did not take the high school grades into consideration. It was all based on an entrance exam, which was based on your high school. So I did that, and it was the same thing, but I managed to come out top on that, so I got in. So it's a little tricky to explain the system there.
Okay, thank you.
Yeah.
I hope that answered that person's question as best as they.
In other words, it's all there. All there is peer pressure and peer pressure and peer pressure.
Yeah. Okay, thank you.
Another member asked me, what would you have done differently if given a chance to go back to our age? So that's around 16 to 18.
I really wanted to be an automobile engineer in the beginning, in around my 10th grade. I just liked cars, and so that's the decision which my parents influenced me into. So they didn't. So in India, in 10th, around when you finish your 10th grade, when you go into your 11th grade, you have to decide what career path are you going to go on. Are you going to be into science? Are you going to go into math or technical? Are you going to go into commerce or arts? You have to have a general idea, because if you don't, because you have to choose your subjects or the pathway based on that. So at that time I had this flirting liking for, oh, I like cars, maybe should I try automobile engineer, all these thoughts come into your head. And my parents said, focus. You always said you wanted to be a doctor. What is automobile engineer in the last minute? So focus. And so they just like pushed me into that science field back then, which I don't complain now.
Thank you.
So I kind of have a question as like a follow-up to that. So were there any extracurriculars you participated in India, or was it, as you were saying, like only like was there no point in extracurriculars?
I did till I was in till my 8th grade, but from my 9th grade, I did not have time. Um, it was just all school studies. But till my 8th, I mean, I used to play I was learning. I mean, I can say I used to play. I was playing it decently, a classical Indian instrument called mridangam. Um, I used to play a little cricket here and there, but that was it. But once I got into 9th grade, the pressure starts right there, and I did not have time.
Oh, okay. Thank you. Once again, if anyone else has a question, just go ahead and shoot either me or any of the other officers a DM, and we will go ahead and ask the question for you.
So someone asked, what are the most rewarding aspects of your job and what do you look forward to while working?
Well, the rewarding aspect is if your treatment goes according to plan and everything goes according, and you see the patients improve in front of your eyes and they're so grateful, nothing like that. So in some cases, sometimes it's instantly rewarding, sometimes it takes a while. So it's very difficult for us as physicians. We learn medicine, we learn what are the conditions are, how you treat it, but each human body is so different. You institute a plan, and then you reevaluate and see, okay, did it go well or not? When it goes according to plan, nothing like it. But obviously, so in some places it's like your plan doesn't work, go to plan B, plan C, plan F. So was there another part to that question?
That was really it. Thank you. Once again, like Akash said, if anyone else has questions, feel free to ask.
So yeah, we actually have one more. So the question was, what kind of medical researches have you conducted thus far?
I was not much into research. The one research I did was in my residency program. It was a joint research with a dental resident and me. There is a medicine. It's a medicine. It's pretty common now. It's a medicine to treat osteoporosis. But back then, medicine was sort of new. It was in the market for a couple of years, and there was some question whether it caused a problem in the jaw. And we tried to do a case study. We tried to recruit patients and do research into it. So that was, and we actually got a prize at there's an inter program within the residency program. There is an annual award which goes to the best research project. So we got that. We won that project for the prize for that project. So that was my only notable contribution to research.
Okay. Thank you. Kind of a follow-up to that, actually. So if you didn't really do medical research at all, did you do any more surgical procedures, would you say?
No, I didn't. I mean, we don't do surgical procedures in internal medicine. We do some, right. We do some office-based procedures like injecting the knee, shoulders, but we don't I wouldn't call it surgical procedures.
Yeah, okay, I see. Thank you. If no one else has any questions, I'll go ahead and wait for one more minute. But if no one else has any questions, we can go ahead and close out. And also, Dr. Vivek, if you wouldn't mind leaving your email, maybe just in case people have any lingering questions after the meeting.
Oh yeah, sure. Like in the chat.
Yeah, in the chat. It's fine.
Okay, yeah, it's great. Thank you for giving me this opportunity, guys, and hopefully, whatever I said will benefit most of you. And good luck.
Thank you as well. And I just wanted to go ahead and close out and say, like, our membership was particularly interested in your area of expertise, and we were honored to hear and benefit from your experiences. And I also wanted to express my appreciation for our advisor, Mr. Chow, who helped us launch this organization and is supporting us on multiple fronts. And for the people in the audience or the participants right now, I encourage any of you guys to suggest future speakers for our seminars based on your interest areas in the future. Thank you.